Live look right now. America, though, is currently on fire with COVID-19. A live look in Johnson County at I-35 and Shawnee Mission Parkway from our Casey Scout Cam. Right now in Johnson County, the COVID positivity rate stands at 17.5%. The growing COVID numbers and what it means for us. The morning medical update starts right now. Good morning to you. It is Tuesday, May 24th. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Coming up, a blood emergency now declared in the Kansas City metro area. How and where you can help out. That's coming up. And here in about 15 minutes, Dr. Dana Hawkinson joins us with the latest COVID count. And the numbers say it best. Cases are on the rise once again here in our area and across the country. This graph from Mark shows the increase over the last few weeks. So what else are the numbers telling us? Get your questions sent in to us on YouTube, Facebook, Twitter. You can email us at the Medical News Network. There are links on your screen. And I know we have several reporter questions. We are going to get through a lot of this initial information, and then we will get to those here in just a few moments. In Johnson County, the CDC says that your risk of contracting the COVID virus is listed as medium, meaning those at risk of severe illness should wear a mask everywhere they go, along with making sure they are fully vaccinated. Also get tested if you show symptoms. So that's what medium means. Now, this chart by the CDC shows the severity across the country. Take a look at that. Here in our area, community levels for Clay, Jackson, and Platte counties, they are low, meaning it's only recommended that you wear a mask and that you should stay up to date on your vaccinations. The same goes for Wyandotte County. Now, earlier this month, Dr. Hawkinson, Dr. Stites both predicted the arrival of a new COVID-19 wave within 6 to 8 weeks. Joining us to talk more about that is Dr. Amber Schmidtke, Chair, Division of Natural Sciences and Mathematics at the University of St. Mary. And also joining us here at the desk, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control with our health system. Good morning to both of you.
Hi.
Hi. Dr. Schmidtke, thank you for being with us. We appreciate it. Always good to hear from you and your insight. We look forward to it this morning. Dr. Hawkinson, though, I want to start with you. Is this the wave that we've discussed?
Yeah, I mean, I think we're in it. I think right now what we're seeing is that the original Omicron variant has been replaced by two subvariants, BA2 and then BA2.112. Don't know the exact. But that's what we're seeing right now. And I think we have seen that in the UK. We've seen that in South Africa with BA4, BA5. I think we are in the throes of it, and that's just what is happening. And that's what we have seen really start happening since we've had that Delta Omicron surge. It's just now this new variant is coming in. I think we are kind of in the throes of it as a nation, and we are still probably in the early stages here in our community.
So 94% of U.S. population living in areas with high levels or substantial transmission levels. So what could that mean time-wise for us? You say, are we kind of in the line of that? Are we coming down the pike?
Yeah, I think it is coming for sure. Yeah, and again, I think people are getting together. They have been getting together now with graduation parties that have been going on or will be going on. We know that there's probably a lot of weddings and other celebrations that we'll be having, obviously the summer holidays, so all of those things. But hopefully if we can do a majority of those things outside, really use those public health guidance, those non-pharmaceutical interventions to reduce our risk of getting it, that can happen. And I've heard more and more stories, more and more anecdotes of people who survived 2 years without having been infected with SARS-CoV-2, and now they are getting infected. And so I think we are seeing that as well.
Dr. Schmidtke, your insight, your thoughts, and I also want to know about the impact of fewer testing, people reporting it less and less. I mean, how are we to know?
Yeah, it's a good question. I think that when we look at things like community transmission levels, we're really kind of looking at the best possible case scenario. And even that is kind of bleak at the moment. And the reason why is because we know that not a lot of tests are being reported to the states and to the federal government because of the popularity of at-home testing, which is fantastic for making sure that you are not bringing infection to graduation or to prom or to any other family gatherings. But unfortunately, those results are never reported, so we don't see them. So, you know, it's a murky sort of situation right now. We know that things are on the rise, but we don't have a firm grasp of just how high things are. And so if you're a person who's immunocompromised, this is a time to really be very careful. And for the rest of us, I think there's also a lot, like Dr. Hawkinson was saying, that we can do to take advantage of the really great weather, maybe not today, but that we seasonally have at this time, to move your gatherings outside and still celebrate, because I know we're all tired of this pandemic and we're ready to move on to normal. We can approach a lot of normal by doing those things outside.
Yeah, finding the balance. Dr. Schmidtke, you never come here to our show without bringing along your slides, which we like because it really helps us better tell the story and grasp what's going on. So I want to pull up the first map that we have here from the CDC. Came out with the peak of the Omicron wave. So talk to us about the map and why you say it doesn't necessarily portray what's actually happening. What do you mean by that?
Well, you know, the CDC has several maps that they've produced about COVID over time. And for a long time, we were using a map that looked at community transmission levels. The one you're looking at here, they introduced right at the height of the Omicron wave back in January. And it is using COVID case rate, hospital admissions, and patient census in the hospital. So how many people are there because of COVID, to estimate the difficulty that one would have in accessing traditional or normal standards of medical care. Would it be difficult for you to find a hospital bed for you if you needed it? And so this is going to show green means good, as you might imagine. Red means things are pretty rough, and yellow, medium, means that things are in kind of that medium space. So the challenge here is that this map only updates weekly. And it's also, we know that hospitalizations are a lagging indicator. So we may not get the early warning from a map like this as we would with the map that we previously used, which is called the community transmission level map. And so I just wanted to come to the show today to just make sure, as we're hearing about cases on the rise, just a caution that this may not be the map for you if that is something that you're concerned about. This is really a map more to sort of test or see the strain that exists on hospital systems.
Yeah, I'm glad you point that out. That's a pretty and a happy little map right there. So perhaps not what it really looks like and what's not to come through the summer. And on that note, I want to mention there was a recent article that came out from the New York Times saying that the staycation is not dead. So as COVID happens, inflation is a mess, travelers are staying close to home. I want to hear from both of you, and Dr. Schmidtke, I'll let you start, but is this the right move right now? I mean, how much will just kind of sticking with what we've done over the last couple of years and making some adjustments when it comes to what we do and our activity levels, how much do you think that might help?
I mean, yeah, anytime we can avoid sort of exposing others to infection, that's a good thing. I know personally, we have done a lot of camping since the start of the pandemic because it's sort of the pandemic-proof vacation. You're self-contained, it's almost all outside. And so in fact, we're going this weekend for Memorial Day.
Dr. Hawkinson, your thoughts on traveling? I know you did a little you've done some through the through this entire pandemic, but what are your thoughts about continuing on with that or finding that balance, I guess?
Yeah. I mean, again, I think this goes to that individual person or that individual family. I think probably more than COVID, I think it's going to be the financial impact of that person or that individual or that family. We know with the gas prices, would certainly urge you to, if you are going out into those places, if you are traveling, if you're not driving, but you're using other public transportation like planes, buses, all those things, in the terminals, in the transports, in the planes, wear your mask. I think that's going to be an important thing to do. Again, you also don't want to bring the virus to those loved ones or those family if you're visiting them, and you don't want to be sick on your trip either.
Dr. Schmidtke, Philadelphia reinstating a mask mandate in schools. We know schools just about, I know my kids are getting out in a day. So, but as we know, the surge comes through the summer, and then I think every parent wants to try to predict what the next school year is going to look like. It's been that way for the last couple of years. But is that something that we might, if we're doing crystal ball moments today, might want to think about considering? Too soon to tell.
I think it's really too soon to tell. I think this year is going to be different than any of the ones that we've had since the pandemic really started, because this is the first year that we've really kind of let go a lot of the public health mitigation strategies that we've used in the past. So in some ways, it feels like we're in uncharted territory. And so we just have to see what happens with, the levels of community immunity that we have. And to what extent does that shield us from some of the higher burdens of a COVID wave. And so I think this summer will be very predictive of what we might be able to anticipate in the fall.
Hawk?
Yeah, I mean, I think from the pure medical standpoint, public health standpoint, I think probably the masks are going to be very important and would be a good thing to do and a positive thing. Not so much for having severe disease with those children or those people in the school, but rather keeping them well, keeping them being able to be in school. Now, of course, we know these decisions aren't made just on medical advice and medical data, but other things as well. And we know there's a lot of vitriol against masking. So therefore, I would say, also make sure that you and your family are up to date on vaccines. And I think we have some good outlook here coming for those younger children now in the next few weeks, with looking like there will probably be an emergency use authorization for vaccines for those younger children 0 to 5. And of course, we know that boosters have been approved for those older children as well.
All right, let's pull up this chart if we can now. The latest Missouri sewer shed surveillance project. They find that the levels of COVID are on the rise in the wastewater in this area. Is this a surprise? Will we see it go up even more? One of you jump in and get us started on what we can tell about this. What does it mean?
So for those who may be unfamiliar with how to read the chart like this, anywhere that you see a yellow watershed, what that means is that the COVID levels in the wastewater are stable. They are not really increasing or decreasing. If you see a red, that means that they're on the rise. And if you see something in gray, that means that they did not have enough data to say anything meaningful about what they saw there. What I should mention is there were, I think it was 49 sites in the state over the last week that didn't have any data at all. So there's a lot that we can't see at the moment. But what we can see here is that things have risen certainly for a couple watersheds over the last week, and for others it remains at that stable level. What's nice about wastewater surveillance is it does give us sort of a heads up of when things are going up and when things might be going down. It's not always 100% predictive, but I would not be surprised if we see this continue to rise.
So if we look back at that map, though, we can see areas with increases around Liberty, Johnson County. What does that tell us? What do we know from this? What could it predict?
So when you have levels that are rising, the reason that is happening, no, you can't get COVID from drinking sewer water, although of course we never recommend that. But what it means is that these are people who have, they're shedding it in their fecal material because maybe they've cleared infection or their immune system is starting to kill off that infection. And the waste products of that virus are what we're detecting in the water. So I don't want anybody to freak out and think that, the local stream is teeming with COVID. That's not the situation. But it can be useful, again, for us to be able to see when the peak may crest and that sort of thing. It's been helpful in the past.
So Dr. Jha, he is the new COVID-19 response coordinator for the White House. He was formerly at Brown University School of Public Health. Dr. Schmidtke, what changes does he want to make?
Well, it's interesting. So he took over the role probably in, I think it was late February, early March. And he has been a very important science communicator throughout the span of the pandemic. And one thing that he kind of pivoted with this week was mentioning that we need to really be paying attention to the counties that are called high transmission counties, because that's where we maybe really need to start be wearing masks a lot more, adhere to that policy a lot more strongly. And that's a departure. Previously we've seen a lot of dependence on that green map that we showed earlier. And instead what he's suggesting is that we probably need to start paying more attention to the red, orange, yellow, blue map that I think we're going to look at in a little bit. And so we'll take a look and see where those counties are in the nation and where they are in the local metro area.
All right, coming up in just a minute, the COVID-19 vaccine will soon undergo changes. We're going to tell you what that means for you and why it is happening. I do want to get to a community question, though, this morning from Randy. Dr. Hawkinson, Randy wants to know if we're seeing an increase in vaccination rates just here in our area that we know of. And what does that mean? Is herd immunity finally going to be a reality?
Yeah, I don't think we're seeing any increase. Again, we know that after that initial primary series of vaccination, we know that the demand for the boosters, and especially now this second booster, so a fourth dose if you're immunocompetent, really the uptake has been fairly low. And so I think that is important. What overall does it mean for herd immunity? We aren't really looking so much at the typical or the historical herd or population immunity that we were for something, say, like chickenpox or measles, that you can obtain from the infection or the vaccination, because we know that even if you are vaccinated and up to date, you can still get SARS-CoV-2. You can still get that infection. What is the important part about vaccination and the immunity derived from that? Number one, it's much safer than infection or reinfection, but two, it is going to significantly reduce your chance of going to the hospital. And so I think it has to do, yes, with some sort of herd immunity and population immunity, but really what it's going to be important for, the vaccination, what it's going to be important for, is really increasing your chances of staying out of the hospital, increasing your chances of not going to the ICU, overall having that immune response so that if you are infected, you can develop that protection further and really try to get over that virus a lot easier. So it's not really the traditional herd or population immunity that we're used to.
Dr. Schmidtke, vaccination rates about 62% of the population fully vaccinated in the Kansas City area. Compare that to the rest of the country. How are we looking?
We're only a little bit below the national average. We're not that far off. So in that sense, I don't think that we're necessarily in terrible shape compared to the rest of the country. But like Dr. Hawkinson said, there really has been a slowdown when it comes to vaccine uptake among the population. It seems that those encourage those who may be considering it to go ahead and do so. And this is a great time, really, when we can see that cases are on the rise, to go ahead and take advantage of that opportunity. I think that in some ways, as awful as the Omicron wave in the winter was, we are benefiting slightly from a lot of local immunity because of how many people got sick. The question is how long that immunity is going to last from natural infection. And so if you haven't gotten that booster, go ahead and do so. Or if you haven't been vaccinated at all, go ahead and start that series.
Yeah, I think that's a key point exactly. You know, for you as an individual, if you receive that primary series and that first booster and you were infected, since December when we really had still Delta and some Omicron, I think if you've been infected, you now have some component also of that natural immunity, that further infection boost to that immune response that has already been generated by the vaccine. So I think that's another important thing to remember as well. Certainly, it is still recommended that if you have been infected, to get that booster if you are needing that booster to be up to date. Now, you can put that off for, say, 8 to 12 weeks. I think the recommendation from the CDC was you are welcome to kind of hold off on getting that vaccination for about 3 months or so. Same thing goes for if you were infected and got the monoclonal antibodies. It's certainly recommended to still get the vaccine, but it's recommended to get that about 90 days after that monoclonal antibody dose.
Doc Hawk, our numbers have been low, but let's get our official COVID count today.
Yeah. So we're still doing good in the hospital, still low single-digit numbers. 6 active infections, 1 in the ICU, that person's on the ventilator, but 4 in that recovery period. And I think what we're also seeing as moving through here is that sometimes we have alternative diagnoses for those active COVID, but we know that people who have things like heart disease and lung disease, kidney disease, COVID can certainly push you over the edge as well. Overall, I think we are still pretty happy and optimistic that the numbers continue to be in those single digits for the active infections.
All right, if you are just joining us, we are back this morning with Dr. Amber Schmidtke. She is the Chair Division of Natural Sciences and Mathematics at the University of St. Mary. And of course, Dr. Hawkinson here at the desk with me. We are talking COVID and numbers and what we can expect as far as this upcoming surge that we seem to be already in, if you will. So, Dr. Schmidtke, officials are expected to decide on a new COVID-19 vaccine design in early July. What will that look like? What is the protection against future surges?
I will probably defer to Dr. Hawkinson on this one because I read that I am not as well read about the new developments with the vaccine.
All right, you are up.
Yeah, we know what they are working on. They are working on pivoted spikes, and whether that was the beta spike or the Omicron spike. Again, one of the nice things about the mRNA technology is that we are able to pivot fairly quickly. So they are looking at some of those alternative or variant spikes, but also what we're talking about is possibly bivalent vaccines. What that means is 2, so maybe 2 different spikes. The original say, Wuhan isolate, or WA1 is what is referred to a lot of the times, but also possibly pairing that with, say, either the beta or the Omicron spike for future generations of that of that vaccine. And I think we should be expecting some data about that within the next few weeks, if it is to be ready by the fall. So that is fairly exciting. We know that those companies are working on that.
And what about kids under 5 getting the shot, 80% effective against Omicron? What does that mean for kids?
You know, again, I think the 80% was, again, this is data from the company. That 80%, they are still in the process of acquiring all the data and analyzing it, but in this interim analysis, what it showed was 80% against infection. We know that when the initial data came out for the vaccines, the protection against infection was quite high, but we know that decreased or contracted over some time. And so I'm not as high on the protection against infection. It is a good thing, but I think we have to expect that percentage will go down as time goes on. What is more important is if you can have that sustained immune response, really to protect you or protect the children from going to the hospital and having that severe disease, because we know that during the Omicron surge, we saw many more children having to go to the hospital. And so that is really going to be the important thing here as we move through time to see what are the true effects of that vaccine over the long term.
We are getting a lot of great questions this morning from our community, and we've got some great ones from our reporters. We're going to get to those here in just a few moments, but we've got a couple more slides that we want to get through with Dr. Schmidtke. Dr. Schmidtke, this map uses recent case rate and test positivity data to estimate the likelihood that you could be exposed to COVID-19. Talk to us a little bit about that. Volume here real quick. Okay, sounds good. We are going to get Amber back as soon as we can, but I'm going to go ahead, Dr. Hawkinson, and let's answer some reporter questions, because we've got some good ones. I knew they'd be coming in when we knew we'd be talking about COVID today, but I do want to ask you about, okay, so this is from Natalie with the Kansas City Star. How long do you think this wave could last, and how should readers modify their behavior? Readers with the Kansas City Star in our community modify their behavior during this time?
You know, typically what we have seen is that those surges typically last 6 to 8 weeks. Now, I think it's going to be hard to tell moving forward how it is going to be. I think we have many changes, many differences now from where we were in the pre-vaccine era until now. We also had the Omicron change, which really caused a lot more infections and a higher case count than previous. So there are a lot of caveats to that. But overall, you know, typically we expect 6 to 8 weeks for those surges. But I think we also have to add in there that individual immunity or that family immunity if you can be vaccinated and up to date. And I think really what we're looking at as far as the surge goes too is not just cases, because it's going to be hard. We've heard about that just in the earlier segments. What is going to be the real bellwether is the hospitalizations. But we know now we have the tools to help protect you as much as possible against hospitalization. And that's being up to date with vaccination. So that is what the readers can do. But it is also getting tested early to get on Paxlovid early. You know, being up to date with your vaccines and being on Paxlovid is going to significantly reduce your risk of hospitalization. The other things that the readers can do is obviously understand where they are, what situations are they going into. Right now we are seeing the cases climb, and on that heat map that we were going to be going through, we saw that the chances of being exposed are high in our area right now if you're doing those high-risk situations like meeting in small areas, in those enclosed areas with a lot of people. So obviously wearing the masks is always going to be important, and you are always welcome to do that if you choose to do so.
Natalie has a couple more questions. With the underreporting of positive COVID cases, how much higher do you believe that the local case numbers are than what's really being reported? I mean, it is so difficult to tell. What do you do?
Yeah, I mean, I think we have to look back historically and just understand that. We do understand that the circulation of the virus is increasing. Typically, we say it is probably 2, 3, 4, 5 times higher as far as the number of cases, but you also have to remember there are those asymptomatic cases as well. So I would say anywhere from 2 to 5 times higher than what is actually reported based on the historical evidence that we've had.
Are there any other infectious diseases the hospital is concerned about in the Casey area or beyond?
You know, I think we are always worried about those things. So I think right now, in my practice, my ID practice, we know that there is an epidemic of syphilis going on out there. We treat syphilis regularly every day, and I think these things have been expanded because of the pandemic. It is decreased testing, less access to testing, more people the ability or who are now being out after they were shut in or locked down or not doing things for so long. The other thing that obviously we are working on and have been prepared for is monkeypox, which we know is high in the news right now. So, you know, we continue to be vigilant. We have our infection prevention and control nurses and team who are ready to deal with those things. We already have systems in place to identify and do the proper things and the safe things here at the health system.
Let's stay with monkeypox because Kara with WDAF has a question. This is something that has not typically spread and is usually easily contained. She says there's some news about it possibly being sexually transmitted. What do you know about this? How concerned should the general population be with monkeypox?
Yeah, so monkeypox, again, you don't get it from monkeys. Monkeys were incidental hosts. That's what was originally discovered. The real host probably is small rodents, but humans can also be incidental hosts just as monkeys can. We know that there have been cases in the United States before. We know that in July of 2021, we had a case who was a traveler from Nigeria. We know that in 2003, there was a large outbreak in the United States with over 70 cases over several states. And so this is not new. But we know, unfortunately, some of those countries in Western and Central Africa have been dealing with an increase in cases over the last few years. So that is what we are seeing now. And then it is not sexually transmitted. It is really transmitted by close contact. So obviously sexual transmission would be close contact, but it's not just through sex, it's through other close contact. And we are seeing that now with these certain clusters as well. So really anybody can get it, man or woman. It is close contact with those people that have, mostly it is the open wounds. It's coming into contact with those wounds or those pox lesions or the fluid from them as well as how it is spread.
All right, any other reporters on the line today? All right, we are good. We're going to get back with Dr. Amber Schmidtke. I want to pull back up your graph that you were talking about, this map, and tell us exactly, Dr. Schmidtke, how the South is really a good indicator of what's to come here in the Midwest. Explain what we're looking at here. Doesn't look good.
Yeah. Are you able to hear me, just to confirm?
We are. Yeah, loud and clear.
Okay, good. So, yeah, this is the map that I was talking about earlier. This one is based on recent case rate and test positivity. So unlike the previous map, this one is there to estimate the likelihood that you would be exposed to COVID-19 in your local area. And as we can see, about 60% of U.S. counties are in that high range, where Dr. Jha was saying it's a good idea to start wearing masks. And that includes the Kansas City metro. You can see there's almost sort of a diagonal streak of yellow and blue that goes from Montana down into the south, where you see that there seems to be some sort of protective effect right there. I think that really this is more rural spaces where it's harder to ascertain case rate and test positivity in those areas. And again, like I was saying earlier in the broadcast, this represents the best possible situation because we know how many cases we are likely to be missing because of the way that home testing is preferred at this point, and that a lot of people just aren't getting tested because they're ready to be done with the pandemic. So I think that we can expect that, you know, this is going to, we are in a surge. We are certainly in the surge. And so I don't know that we have any breaks on this infection, wave at this point. And so it's on all of us to try to do what we can to limit transmission. Like Dr. Hawkinson said, We can certainly hopefully count on those vaccines to prevent us from going to the hospital. But in the meantime, it does pose a significant burden to be sick with COVID in the first place. And so if we can avoid that, that means fewer missed graduations, fewer missed weddings, fewer missed opportunities to be with the people we care about and love. And so I think it would just be a good reminder that, none of our strategies are bulletproof vests. We are still having to layer those strategies together.
Dr. Schmidtke, do you have one last pie graph you want to show us?
Yeah, I just wanted to talk about how that graph that we were just looking at, or the map rather, of the red, orange, yellow, and blue counties, we have really seen this take off since mid-April. The upper left pie chart is looking at April 10th, and you can see that about 25% of the U.S. counties were in that higher substantial range. And if you look at the present time down on the bottom, that has flipped. Now 75% of U.S. counties are in that higher substantial range. And that's really where a mask is probably a good idea. And so it's a good idea to pay attention to those community transmission level maps to try to ascertain your local level of risk.
Dr. Hawkinson, I want to get to some community questions. There's several for you today. Sandy wants to know, does anyone have immunity to monkeypox, like folks who have been vaccinated against smallpox?
Yeah, so what we've seen in the past is that those who have been vaccinated against smallpox do have immunity, and that is one of the reasons why we thought there was we were being able to keep monkeypox at bay. However, we stopped vaccinating against smallpox here in the United States in 1972, and smallpox was declared eradicated from the planet Earth in 1980, and so those vaccination campaigns against smallpox really stopped at that point. As you move through time, those other generations now have not been vaccinated, don't have immunity, but we have seen that people who have been vaccinated against smallpox do have some immunity. It's about 85% protective in protecting you from monkeypox. One of the strategies to help stop the circulation or the spread of monkeypox is vaccinating those close contacts as well, with approved vaccines now for smallpox.
Tamara wants to know, is Paxlovid available everywhere, particularly in southeast Kansas? Is it easy to get your hands on?
Yeah, it should be. There is a Health and Human Services tracker where you can actually track the availability of that medication. I haven't looked on it recently. I know we have plenty of supply here at the hospital. Initially, when Paxlovid came out, it was very difficult to have supply, but I think as we moved now from that time, the ability to get that, the access, is much greater.
All right, couple more questions. Ashley is asking, can you review what the guidelines are for me? I'm 38, I've had 3 shots, but I'm close to 6 months since my booster. Can I get another booster, or am I good?
Yeah, right now it is really for the 4th dose would be for those that are 50 and over at this point in time. Or if you have a significant medical condition, an immune compromised condition, you're able to get it. But right now, if you are otherwise healthy and 38, really that 3rd dose should be the best.
Isaac says, after I recover from my current bout of COVID, yes, get well, Isaac, please. How safe will it be, and how soon can he get to the water park? He has season passes. He loves to be outside and hanging in the water, as we all do. So how safe will that be? Yeah,
I think, again, the water park, you're outside, you're doing things. Again, the recommendation would be to stay isolated for 5 days and then wear a mask for 5 more days for that 10 total days. Obviously, if you're at the water park in the water, you're not going to be wearing a mask because it won't work. So if you really can wait that 10 days, is probably going to be the safest thing to do.
Sandy says, thank you for answering her question about monkeypox, but is also asking, will smallpox vaccination be reinstated?
At this point in time, there is no plan to reinstate it for the general public. We know that it will be used in those case investigations, those contact case investigations. We know that that strategy was used in 2003 when there was the large outbreak in the United States, but right now there is no plan to reinstate it for the mass public, for the general population.
Okay, I'm going to ask this last question for Fanny. I was positive with symptoms all last week. I tested negative with a home kit yesterday, waiting a PCR result today. Says that today my home health folks are not comfortable treating them. Are others experiencing work requiring a doctor's note to return? She's curious if she needs a doctor's note to return. Thank you for answering. She's triple vaxxed, double boosted, wants to know if she could see her 100-year-old mother yet. So, but it sounds like she had a negative test at home, but
yeah.
she's still having symptoms, so she needs that PCR test.
Yeah, I think that's right. I think getting that confirmatory PCR test is the right thing to do. And then really I would wait that 10 days from when the start of symptoms. It sounds like she's a week or more into it at this point in time, so it wouldn't really be that long. Really after that 10 days, you should be okay to get back out and do what you want to do. Now always, if you are concerned about others and their status as far as immunity or age or comorbid conditions, you are certainly always welcome to wear a mask. But really it's waiting that 10 days. You really should have very little to no active viral replication at that point and will not be infectious.
Okay, I do have to ask this last one for parents. My daughter just started playing basketball with other girls her age. Nobody masks. She hasn't been boosted yet. What should we be looking for before we start masking again and practicing games? Is that just your own personal risk again?
Yeah, it is. I think you have to judge your risk in your family or your bubble, and try to make those decisions, taking in all that information for yourself at this point in time. Yeah.
All right,
keeping your family safe is the most thing.
All right, let's get to our final thoughts. Dr. Schmidtke, as always, great to hear from you. What do you want us to know?
I just want to say that I'm as ready for this pandemic to be over as anybody else. And I think that, I don't know that we're necessarily done with this thing, but I hope that we are at a more manageable level than we have been in the past. We do have a lot more tools at our disposal than we did previously when it comes to treatments. And I think that people are more aware of the different strategies that are available to them. It's just a matter of using them.
Dr. Hawkinson, your final thoughts.
Good questions. Again, I think we had a lot of questions about vaccination, staying up to date with your vaccination. If you are 50 and above, obviously they've okayed that second booster. We know that children can get that booster now, and we are still overall for vaccination awaiting those younger children's, waiting for that vaccine to be authorized or approved, hopefully within the next few weeks. That will be an important thing to do. And again, just moving through now, understanding your risk of getting the disease, understanding those situations that you're in is extremely important. You are always welcome to wear a mask if you do have symptoms, as we heard from some of these questions. Test early, get on Paxlovid early. Those things will help reduce your chance of going to the hospital. We are probably in that surge now, or at least in the beginning parts of that surge from what we're seeing. But hopefully, as we can take some lessons from the UK and South Africa and know that hopefully the hospitalizations will be low and certainly not to the great extent that they were in the winter with the Delta Omicron surge.
Thank you both for answering all these great questions today. In headlines this morning, the blood emergency here in the metro, it continues on. The community blood centers have just the bare minimal supply of blood. And Andrea Bipley is the Director of Donor Retention at the Blood Center. Andrea, thank you so much for joining us today to talk about this. Before we get to some questions, I want to let everyone know we have a QR code on the screen that will direct you to where and how you can donate blood here in our community. Andrea, so normally blood supplies do drop this time of year. We know that, but with the blood supply still not fully recovered from the pandemic, how bad are we talking right now?
Sure, absolutely. We like to have about a 7-day supply of all blood types on hand. Right now, most blood types are at 2 to 3 days, with type O at 1 to 2 days. Our platelets are also very low, so it really is an emergency situation right now.
So has it changed at all? I mean, we've been talking over the last 2.5 years. Is it still just flatline what we've been looking at? No changes?
It has increased at times, but what we find is we just can't seem to get beyond this emergency level. We need to have more donors coming in the door consistently to meet the needs of our local hospital patients.
So for folks watching right now who are clicking on that QR code, I know they can get more information, but what should people know if they haven't donated in a while or never have donated before? What are some things they need to keep in mind?
Right. You just need to be at least 16 years of age with parental permission. Remember to eat well, drink plenty of fluids. We have 7 donor centers and lots of blood drives available. So we welcome you to come in and donate blood.
So the Community Blood Center, are you doing something special this week to help increase those numbers?
We are. We know that blood supplies will dip even lower with the holiday, with Memorial Day. So we are giving away a grill, 2 grills, May 24th through the 31st. Anyone who comes in will be registered to win a grill. And we're just encouraging people to make time with their holiday plans to schedule a blood donation and come in and share the gift of life.
Let's encourage people even more. Tell them how easy it is and how quick it can be.
It's very easy. So the whole process takes about 60 minutes from the time you walk in the door to the time that you leave. Only about 7 to 10 minutes for the entire donation. So very quick, very easy, has an immediate impact on hospital patients in our area.
That immediate impact, that makes the difference. Thank you so much. Come back anytime. Love to help get the word out for you.
Thank you.
Thanks, Andrea. And thank you so much for being with us today. Don't forget, you can catch our shows anytime by logging back onto Facebook, Twitter, and YouTube. Go out, make it a great Tuesday. We'll see you back here tomorrow at 8.
Alzheimer's disease is a leading cause of dementia in seniors. I'm Jill Chadwick. On the next Open Mics, the impact COVID has had on Alzheimer's patients, plus doctors weigh in on at-home tests for memory loss. We'll see you at 8 on these social media channels. Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.